Now I'll be taking you through the IP. So we have two types
Okay.
of admission. One is through the friend desk dashboard, and then other is by the doctor's referral to admission. Okay.
Your
Now
screen
I'll
is
be
not
show.
visible to me.
Okay, 1 second, sir.
Yeah.
Now it's clear to you.
No.
Now is it visible?
No. Yeah. It's fine now.
Okay. So we have two types of admission. One is admission through the front desk dashboard that is done by the receptionist, and other admission is done by the doctor through the referral admission. So first, I'll be taking you through how to do the admission from the front desk dashboard.
Okay.
So, so this patient is being admitted today to the hospital. So for admitting this patient, you can click on this action button. After clicking this action button, you can see over here admission. So click on the admission. Okay. So once you click on the admission, now we'll be moved to the admission details. So now you have to give the admission details over here.
Okay.
So the department and this now you have to select the department. 1 second, sir. So I've selected the department, the physician name, and I'll select the admission type, whether it is accident, emergency, health issue, normal, or planned. You can mention, and then we have the admission date. We also have the feature of entering. Once you have saved this admission, and then you want to go for a backdated option, that also we have available with us. So the admission date is mentioned, then you have to mention the nursing counter. Once you have mentioned the nursing
Okay.
counter, you have to mention the ward and then click the bed.
Okay.
Okay. Now this is regarding the admission, and you can save it. Okay.
Okay.
Now I have saved, and you can see that this patient has been moved from OP to this admission list. So all the admission list can be viewed under this IP in admission list. So these are the patient that has been admitted in your hospital.
Okay.
Okay. Now you want to add certain other details, like if it is an MLC patient, MLC data you want to add. So for that, you can click on this view and edit.
Okay.
So once you click on this view and edit, if a diagnosis is mentioned, you can mention the diagnosis over here, and then in this administrative, you'll be able to add the MLC details. So you can mention the attender detail.
Okay.
Apart from this, you can enter, like with this MLC or insurance patient, you can mention the MLC, and then the attending of treating. If you want to give all these details, that can be added over here.
Okay.
And if it is an accident related patient, then you can mention all the accident details over here.
Okay.
If you want to add any attachment to this of this patient regarding the IP, that can be added in the attachments. And if you want to create a report,
Okay.
1 second, sir. So the report can be added over here. Next is I will be taking you through the advance. So now once a
Okay.
patient is admitted, you will be collecting an advance. So for collecting the advance, you can go to this advance receipt list.
Okay.
So in this, you can click on this add advance. So once you click on this add advance, you can mention the amount that has been that is paid by the patient in the payment mode. So
Okay.
I'll be mentioning it in the cash. And then you can save it. If you want to add any notes, the notes also can be added under this
Okay.
notes. Now, if you want to take the print of this advanced list, that can be taken by clicking on this receipt print icon. So this is the
Okay.
advance receipt. So if you wanna do the changes to this advance the header, that can be changed according to your
Okay.
wish.
Okay.
Okay. Next is next is the IP services. So similarly, how you have added the services in the OP, the same way you can add the services here in the IP. So over here, you can also add the lab and the radiology test. So once you have added the test, you can click on send item. So once the item has been sent, it will be moved to the respective lab and radiology department.
Okay.
So you can see in the send status is mentioned as N because the item has been sent. So once you have click on send item, this send status will show in Y under lab and radiology test. So this is how we add the services in IP.
Okay.
Okay. Next is the nurse notes. Now, for example, if the patient wants to transfer the bed, if he's not comfortable with this bed and you want to transfer the bed, you can click on this add transfer bed. Once you click on the
Okay.
add transfer bed, you can click on the ward number, the bed, and then you can mention whether you want to release the current bed, and you can save.
Okay.
Okay. I'll be showing you one filled EHR of the in IP. Just a moment, sir.
Okay.
Okay, so this is the now I'll be showing you how to add the nurse notes. So for adding the nurse
Okay.
notes, you can see over here the vitals can be added. So you
Okay.
can add according to the time. Like we can see it has been added like in 8:1 to 10:03 p.m. These are the vitals, and then
Okay.
next is taken in 8:5. So all the details can be added, and if you want to take a print of this entire vital chart, can be taken print by clicking on this print icon.
Okay.
Okay. Next is the nurse notes. So in this nurse notes, if any notes has been taken by the like a note has been noted by the nurse, can be mentioned over here. You can mention the pain level, the shift name. This is where the shift name comes. So you can mention the shift name, the nurse name, the date, the pain level of the patient, and then if any notes needs to be added, the notes can be added.
Okay.
Once the notes are added, all the details will be found over here underneath. If you want to take a print of this nurse notes, that can be taken by clicking on this print icon. And if you want to edit this nurse notes, that can be edited by clicking on this pencil icon.
Okay.
Next is the patient intake and output. So you can mention the nurse name here, the shift name, the date and the timing, whether it is afternoon, evening, morning or night. And then over here in this methodology, you can mention whether it is intravenous or extravenous, or it's intake, output, or intravenous. And then next is the type, whether it is through what did the patient intake, whether it's idli, sambar, porridge, what is the intake that mission has been taken. You can mention under type. And in the site, you can mention whether it is taken through spoon or hand. What's the site that can be mentioned over here. Next is the volume. So
Okay.
we can mention the volume over here, like 2.5 or 2.5. And then you can, in the unit, you can mention whether it is in um grams, whether it's taken in grams. All the units will
Okay.
be uploaded for you. If you want to add anything apart from that, that can be also added in the masters. Apart from this, if you want to add any notes, the notes can be added over here. And all the details that has been taken will be mentioned over here underneath. And if you want to
Okay.
take a print of this, you can take a click on the print icon. And if you want to edit anything in this intake and output, that can be edited by clicking on this pencil icon. And if you want to completely rub this off, that can be deleted as well by clicking on this cross icon.
Okay.
Next is therapy. So if any therapy has been mentioned to this patient by they can select the physician name, the therapist name, the what type of therapy, then the improvement marks, whether it is 1 to, like, from 1 to 10, and then the duration of the therapy, whether it's like 10 minutes, 20 minutes, 30. If in notes is there, you can mention the notes. And all the details can be viewed under this underneath over here in this added therapy.
Yeah.
Next is the nurse handover. So in this nurse handover, you can mention the date and time. It is also back. We can do backdated options there for, and then you can mention the current condition status, the recent actions,
Okay.
the current medication, medical history. All the details can be viewed. And then once it is handover, you can mention the current nurse name. Mentioning one nurse name. Okay, this is the current nurse name. You can mention the already the nurse ID and signature. If the signature is added and you want it to be visible over here, that can be also viewed. And you can over here in the next shift, you can mention the nurse that has been handed over to. If you want to view the nurse handover report, that can be viewed over here underneath. If you want to take the if you want to duplicate this report and do a minor change, that can be done by gives duplicate icon. And if you want to edit this nurse handover, that can be edited. And if you want to take a print of it, you can take the print icon.
Okay.
So why, if you're creating a detailed nurse notes and doctor notes, then you will be able to create a good comprehensive discharge summary, as we have the option to copy and paste.
Okay.
Next is the doctor notes. So in this doctor
Okay.
notes, first is like the doctors are adding the notes. So for adding that, you can mention the what note that has been added by the doctor. And if it is a just a visit, you can click on this just a visit and then save. So the details will be viewed under this added doctor notes.
Okay.
Okay, next is the examination. If a doctor is giving any want to add any examination for this patient, that can be added over here by clicking on this respective examination.
Okay.
By clicking on the respective examination, and then you can mention, if the doctor wants to mention any notes from this, they can mention the notes. Next is
Okay.
prescription. So similar in OP case sheet, you have seen the prescription. The similar way you can create the prescription over here as well. Click on the create
Okay.
prescription. Once you click on the create prescription, you will be moved to this add medicines bar.
Okay.
So you can mention the medicine name. The ones that are marked in red needs to be mandatorily added. The medicine name,
Okay.
unit, the unit and dosage will be shown. So you can mention the dosage and then the frequency routine, whether it is like 1:1, twice a day or thrice a day. They meant to
Okay.
take after
Okay.
food, before bed, during at bed. Then the duration. What's the duration over
Okay.
here? You can click. Then next is the prescribed physician. Who's prescribed by this? Who's prescribing this prescription can be mentioned over here, and who's preparing this. If both are same doctors, you can mention both same doctors.
Okay.
Okay. Once all the prescription has been added, if you want to view this taken in regional language, that can be viewed by clicking on this respective language. And then you can take, if you want to take a print, you can take the print by clicking this print icon. So once
Okay.
all the medicines are added, you can click on send to pharmacy for sending to pharmacy. So from once you click on send to pharmacy, you need to give a purpose over here. What's the purpose of this
Okay.
prescription? So you can mention new admission, daily dose. What is the purpose you have mentioned in the masters? That will be viewed over here, and you can give a select on that. And once the purpose is given, you can mention whether it is a priority, whether it is normal or critical. Mention the
Okay.
priority wise, and you can click on send. So this is
Okay.
how you send the this is how to send the prescription to the pharmacy. Our prescription is we our IP is IP prescription can be integrated with our IP billing, so that will be showing as well. So next is the clinical assessment. So in this clinical assessment, you will be able to add all the clinical assessment like the allergy, social habits, blood group, medical history. All the details can be added over here. And to take the print of this can be taken with this print icon. Next is the lab report and radiology. So in this, you will be able to view the patient's lab result over here in this report. This is where they
Okay.
will be, you will be able to view the lab report. Over here, you'll be able to view the radiology report once it is ready. And if you want to compare between to the two reports, that can be compared by clicking on this checkbox and click on compare report. Okay. Next is payer. So if you're giving, if this patient is an insured patient, then you'll have to add the payer details of the patient. So for that, you can click on this add payer and you can add the payer of that particular patient.
Okay.
Okay. Okay. Next is the bill. Sorry. One second, sir.
Yes.
One second, sir.
Okay. Okay. It's okay.
Okay. Next is the caretaker. So if you want to create an attender pass or a gate pass for the visitors, that can be added by clicking on this caretaker. Click on add, mention the details, the name, the role type, the relationship. What are marked in red needs to be mandatorily added, and you can save. By this, we will be
Okay.
creating the by this you will be creating a gate pass. You'll be creating the attender pass or the gate pass for that particular visitor.
Okay.
Okay, now once you have added all the nurse notes and the doctor notes, now I'll be showing you how to create the discharge summary. So for that, you can click on this discharge summary. If you want to add any previous discharge summary of the patient or anything related to IP, that can be added under this attachments. This is the discharge summary format. So if you we do have the option of voice to test. So if you want to voice it out and give it make it into a text, that can be done by clicking on this mic icon. This is the mic icon. You can just enable it and then you can speak it out and then the text will be voiced out over here.
Okay.
Next is if you want to if you want to take the notes from the nurse notes and the doctor to create a discharge summary, that can be done by clicking on this editor icon. So once you click on this editor icon, you will be able to view all the notes that has been mentioned by the doctor and the nurse. So you just have to copy it and paste it into this discharge summary.
Okay.
Okay. And then to take the print, you can click on this print icon. Okay, I know. So this is how our discharge summary is. If you want to do any changes to this discharge summary, we'll be doing it for you
Okay.
according to your preference.
Okay.
So now the discharge summary has been created. Now I'll be showing you how to discharge the patient. So for discharging the patient, first you need to advise advise a discharge. For advising a discharge, you can go to this discharge notification. So once you've gone to the discharge notification, you can click on add advice, and once you click on add advice, you will be moved to this.
नहीं ऐसा मत कीजिए ले लीजिए नो प्रॉब्लम मैं ऑनलाइन क्यों पे करना बोल के क्या नहीं आप मुझे स्कैनर से भी कर सकते हैं नहीं जी मेरा स्कैनर में भी डायरेक्ट कर सकते हैं Thank
So
you.
over here in this discharge advice, you can click on this ad. So once you click on this ad, you can the department of the physician will be added. You can mention the expected discharge date here. Then you can, if you want, if a notes needs to be added, you can give an advice notes, and then you can save.
Okay.
I'll be giving today's date. I'll be giving tomorrow's date. And I have given a note over here. And then you can save it. So once this discharge sum is advised, in the bed transfer, you won't be able to transfer the bed directly. You can go to the room rent. So from this room rent, you will be able to. We have two types of room rent. One is automatic room rent, and other one is the manual room rent. So what's your preference? We'll be accommodating it accordingly. So
Okay.
currently this is now automatic room rent. So you can over here see the room has been calculated automatically.
Okay.
So would you prefer to have automatic room rent or a manual room rent?
Manual.
Manual. Okay, fine. So we'll be doing it for manually. We'll be doing it for you. So this is since this is an automatic, you can this room rent will be calculated, and then you can click on save. So once you click on save, this will be moved to the billing. So I have clicked on save. So you can see the room rent has been sent to billing. So once the room rent is sent to billing, so you will be able to segregate and generate the IP billing for this particular patient. So we can see in this room rent has been calculated for that particular patient. You
Okay.
can now for discharging the patient, you can go to this discharge summary. So you can go to this.
Hello.
1 second. Yes, sir.
Okay. Your voice is not audible.
Now I'm audible, sir, to you.
Yeah.
Okay. You can go to the
It's
discharge for discharging the patient. You can move to this discharge notification. In this discharge notification, underneath you can see add discharge.
okay.
You can see the add discharge, so you can click on add.
Okay.
Okay, since this bill is not, you can see this the discharge cannot be done because the bill has not been saved. So now we can
Okay.
save the bill. So once the payment is received from the patient, you can save the bill. So I'll be saving the
ఏంది
bill
నేను
now.
డ్రా చేసి కట్ చేయాలి అంతే కదా ఇక్కడికి
Can you draw it very perfectly?
చేస్
A size medium.
యు లైక్ ఇట్ వయన్
So over here you can
No,
see the
thanks.
advance has been 10,000
What
paid.
do you
So
think
you
is so?
so 2,450 is
టెల్ మీ
only
ఇస్ ఇట్
amount that
గుడ్
has
ఆర్
been.
బ్యాడ్
So Priya, can you just mute yourself?
నాట్ గుడ్
So the total payment is 2450. So the advance
Okay.
has been collected 10,000. You can see over here refund has been given initiated by 7,550 has been initiated. So we refund type. So you can do the payment from here itself. You
Okay.
can mention the payment type
నువ్వు ఎందుకు ఇట్లా కట్ చేసేసినావు ఇప్పుడు నేను ఏది వాడాలి
and then the refund amount is done and you can click on save.
జరుగు ఐ యూస్ దిస్
Okay.
పార్ట్
So now you can see the bill has been created successfully. Now you will be able
Okay.
to create the discharge for that particular patient.
Okay.
So this refund has been moved to this payment list. Earlier I have showed you that payment list in the accounts module. It has been moved to
Yes.
this payment list over here.
Okay.
What are you doing now? I am making dark G.
దాక్తి కాదయ్యా
So what now?
యూ వాంట్ ఇట్ టు బి పర్ఫెక్ట్ రైట్
Yes. So what are you doing now?
డూయింగ్ ఇట్ పర్ఫెక్ట్
Okay, so once this now I'll be doing the discharging the patient. So for discharging the patient, you can go to this discharge notification.
Okay.
So after the discharge notification, you can click on this add. So now we'll be able to do the discharge. So mention the discharge type, whether it is cured, DAMA, fully recovered, health report, health improved, health normal. You can mention the like respective type, and you can discharge plan date will be automatically showed. The actual discharge date is mentioned over here, and then you can click on this checkbox whether the acceptance has been done, and then you can save.
Okay.
So now this patient has been discharged. So you can see the
Yes.
patient will be discharged. Over here you can see the patient will be discharged on November 14th. And so date.
Yes. Yes.
Okay.
Okay.
So now outside, and now this patient will be moved to this discharge list. You can see this patient has been discharged today.
Yes.
Okay. So this is how you discharge a patient. So I hope this IPF workflow is clear to you, sir.
Yes. Yes.
Okay. Next, I'll be showing you about regarding the IP cancel list. So if you if admission cancel list. So if an admission has been cancelled, then all the admission cancel list will be shown over here. So for canceling
Okay.
the admission, so this is all the where you see the cancel bill, admission cancel list. Next is the caretaker. You will be able to manage the caretaker over here. The attender pass and the pass can be managed over here. Next is the bed management, where I have showed you the dashboard earlier that can be managed over here and under this management. Next is I'll talking about the second type of admission referral. So to the task order, the doctor might have given the admission request. So once the admission request has been done, it will be moved to this admission referral page. So over here you can see over here the status as in new. You can click on this book admission, and once you click on this book admission, you'll be directed to this normal admission procedure. Is this clear to you, sir?
Yes.
Do you have any doubts regarding IP module, sir?
Yes.
Sorry, sir.
Hello.
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 Yes,
Sorry.
sir. So do you have
Sorry,
any
I didn't
doubts
get you.
regarding this IP?
No.
No. Okay, so I'll ask Supriya to share the dummy credentials to you along with this recording. Please go through it and practice in the dummy credential. If you come across any doubt or you want a clarity regarding any module, we'll get back to you. Okay, sir.
Okay.
Thank you, sir, and have a nice day.
Thank you.